It is day 2 of our Mammothon. Allie joins us with details on how you can protect your breast health. Allie.
Yeah, we are live here in the Breast Imaging Center at Roswell Park Comprehensive Cancer Center. And if you're sitting at home this morning drinking a cup of coffee or getting the kiddos ready for school and you haven't had a mammogram, you probably have some questions. Here to answer some of those most frequently asked questions, Dr. Ermelinda Bonaccio. Doctor, thank you so much for being with us this morning. We sincerely appreciate it. Okay, so I show up to Roswell Park here, downtown, the downtown campus. What can I expect next, and how long would you say the process takes in total?
The process takes about 30 minutes in total. The mammogram itself is just a few minutes. There's 2 images of each breast. Yes, you are in compression, but it is only for a few seconds. And then in about 30 minutes, you'll be done, and we will either send your results in the mail, or you can look up your results on the portal.
Simple enough.
Simple enough.
30 minutes can save your life.
Yes.
Once I arrive here, do I need a prescription, and is there a copay?
No. So we've tried to remove all the barriers. You do not need a prescription. You do not have to be a patient at Roswell. There is no copay in New York State for a screening mammogram. So really no excuses to not schedule your mammogram.
Especially if you're over the age of 40. We know
Correct.
that is a critical age. Why is the age of 40 so important to get that yearly screening?
So the data shows that, and these are multiple studies, that yearly mammography starting at age 40 saves the most lives. So this is for average risk women. For women who might be at higher risk, we do consider starting at an earlier age, but age 40 for average risk women.
What are some of those risk factors for younger women?
So it's very important to know your family history. Family members, mothers, sisters who have had breast cancer, premenopausal, in their 40s themselves. Some of the other cancers, ovarian cancer, having a history of radiation treatment to your chest. Usually patients who had lymphoma might have that at a young age. So it's important to know your family history. We are now recommending you have a risk assessment by the age of 25. That's typically done by your OBGYN or primary care doctor. So we can better identify those higher risk women and have them start their screening at a younger age.
And what is a risk assessment exactly? What does that entail for women?
It's a bunch of questions. It's a bunch of questions about your family history, about your own personal history, and then based on some very sophisticated data sets, they'll give you an estimated lifetime risk of breast cancer. But it's important to remember that our biggest risk factor is being a woman. So most women who get breast cancer don't have a risk for breast cancer. So just because you don't have a family history doesn't mean you should schedule your mammogram.
Good information to keep in mind. Of course, if you do want to schedule your mammogram, we do have a QR code on your screen right now. We are making it very simple to make that critical appointment. As we just heard, 30 minutes could save your life. Scott, we're going to send it back to you.